Our first question is, how long should I be trying to have a baby before I seek infertility treatment?
So the question every couple asks is that question. How long should we be trying to have a baby just with natural, unprotected intercourse before we go to an infertility doctor or try to seek help or treatment? And the usual standard answer for that is 1 year. In other words, the chance of being pregnant in 1 year is so high if you're fertile that if it's gone more than a year, then it's time to get treatment. Now, it's a little different if you're 42 or 43, if you're older. The time to get help then is right away because, for a 25-year-old, you have such a low risk of infertility, it's about 10%. But if you're 42 years old, you actually got a 90% risk of being infertile. So you shouldn't waste time because the more time you waste, the harder it will be to get pregnant even with treatment. So we love to treat people that are in the older age group that have problems because their eggs are older, but it's so much easier if you're younger.
Debbie would like to know, would you recommend artificial insemination before going to IVF?
Well, the classical thing is, do we recommend IUI or artificial insemination, like with your husband's sperm, before going to IVF? That is a very controversial question. So I'm just going to give you my view, which is probably different from what you are going to hear from the standard, perhaps conventional infertility doctor. I have been doing this for over 40 years, almost 50 years, long before IVF. And the early days of IUI, it was just an effort for people that had no idea how to do IVF to think they were doing something high, like washing sperm and inseminating it. But the truth is, all of our data showed that timed intercourse was really better than IUI. IUI is just a way for the doctor to charge you money, for the insurance companies to have some protocol, which is a stupid protocol, and for you to waste a lot of money and a lot of time. So you could be doing IUIs, 6 IUIs over the next 12 or 16 months while your eggs are getting older, and it's a waste of time because intercourse would work really just as well. And intercourse and stimulation with ovulatory drugs, which goes along with IUI, intercourse is really a much better way of depositing the sperm than IUI. IUI is really stupid. But it was originally brought up at University of Southern California before anybody could do IVF really well in the United States in 1982. You wash the sperm, you use an infant feeding tube. Most of the young doctors don't even know the history of this. And you put it in the uterus and you think you're doing something technological that's better than intercourse. But the data shows it is not better. So if you need treatment and you're not getting pregnant on your own, then it's better to go right to IVF. And in the long run, going right to IVF is going to be less expensive because the pregnancy rate for IVF should be at least 50% per transfer, 60 or 70% in good hands with younger women. But the pregnancy rate for IUI is not going to be any more than 8%. And that's with stimulation with ovulatory drugs. So this isn't the conventional answer, but it's the correct answer. Don't waste your time with IUI. It's very frustrating and emotionally painful and very unrewarding. So that's my view about if you should do intrauterine insemination first.